Good night, and yours truly, Dolphy Gilpin, is continuing with his CME, continuing medical education. And you will note that in many of my lectures, with regards to the amazing 5x12 matrix, you will also see CME and sometimes EE. This versatile CME stands for sometimes continual mechanical engineering education, continual mathematical engineering education, continual medical education or medical engineering education, and continual matrices education with regard to the amazing 5x12 matrix. So it's using diverse and versatile situation to represent various fields of education. Tonight, CME stands for Continual Medical Education, and we have just done the anatomy of the breast, and we're now going to go on to actual breast cancer. Since you have not highlighted the anatomy, it will give us a better understanding of what breast cancer is. So we say now that breast cancer most often begins in the cells of the milk producing duct. So the breast cancer most often begin in the cells of the milk producing ducts, and we call that one now when it begins like that, invasive ductal. It begins in the duct of the milk gland, carcinoma. And now sometimes breast cancer begins in the glands or the lobules, and we call that one now invasive lobular carcinoma. Now, a little statistics on this breast cancer is that after skin cancer, breast cancer is one of the leading cancer diagnosed in women. That is after skin cancer. Breast cancer is one of the leading cancer diagnosed in women in the United States. And breast cancer can occur in both men and women. Most of the time it occurs in women, but we have the idea that only women get breast cancer, but men can also get breast cancer. But most of the time it occurs in women. Now, the breast cancer survival rate has been decreased, and the number of deaths associated with this disease has declined due to improved care, better understanding of the disease, and improvement in diagnostic and treatment, plus early detection. So let's move on now to the type of breast cancer. So what we have here, 1, 2, invasive ductal carcinoma, 2, invasive lobular carcinoma, 3, we have now angio, sarcoma, 4, we have inflammatory breast cancer, 5, we have now Paget disease, Paget breast cancer. We have recurrent breast cancer. We also have now breast cancer lobular carcinoma in situ, and also now ductal carcinoma in situ. So those are the type of breast cancer that we have. Now, symptoms of breast cancer, we know that now a breast lump or thickening that feels different from the surrounding tissue. So these are symptoms now, signs and symptoms. So we should write signs and symptoms. We have now a lump or thickening that feels different from the surrounding tissue. A lump or thickening that feels different from the surrounding tissue. Changes in size or shape and appearance of the breast. Changes in size, shape, or in general appearance of the breast. Changes in the skin over the breast, such as dimpling. Dimpling. And now we have also now a newly converted nipple. These are signs and symptoms. Newly converted nipple. And we also have now peeling, scaling, crusting, and flaking of the pigmented area of the skin, surrounded by the areola or the breast skin. So that is peeling, scaling, crusting, and flaking. Peeling of the skin around the breast, scaling, crust, flaking, and then last we have no reddening of the or pitching of the skin over the breast, reddening or pitting of the skin over the breast. And this usually occurs in inflammatory breast cancer. We have inflamed breast and it becomes sort of a red, reddish pinkish in color. So that we go through the symptoms and we name now the many types of breast cancer. And we see now that the breast cancer occurs when some breast cells begin to grow abnormally, and these cells divide into rapidly than the healthy cells do and continue to accumulate, forming lumps or mass. And cells may metastasize through the breast via the lymph nodes and other parts of the body. Now, statistic-wise, in epidemiology and statistics, we have known that about 5 to 10% of breast cancers are linked to gene mutation. So we have known that 5% to 10% of breast cancer are linked, I just write in abbreviation, BR, breast and cancer, are linked to gene mutation. And specifically, if you are found to have this gene 1, or B, breast cancer CA1, or gene 2 mutation, or breast cancer CA2, or in the gene mutation, then you are predisposed, or more than likely you could have not only breast cancer, but ovarian cancer. So this is genetically inherited from families coming down the line, and 5% to 10% of breast cancers fall in this bracket. And if you're found to have this gene 1 or gene 2, BRCA1 and BRCA2, breast cancer 1, gene 1, breast cancer CA2, gene 2, then you are predisposed, or more than likely you could have breast cancer as well as ovarian cancer. Now, diagnosis now. Let's write some diagnosis. We have the mammogram. And this is an invasive procedure in which the breast is placed between two plates and squeezed, and picture of the breast is taken, and some women claim to experience pain, or they report pain or discomfort via this technique. And you find that 96% of women going up for mammograms will return with a negative. That is a normal breast. And some will be told to return due to technical difficulties. And after return in 4%, 3% will return normal. Of the returning normal. So that now 96% of women having mammograms statistically turns out to be normal, and 3% of the returning one turns out to be also normal. Well, after the mammogram is taken, after 2 weeks, the results comes in, and they usually write you with the result. And you fall in the statistics that 96% they usually have a normal breast after 2 weeks. And if you are found to have a positive, then further testing will be done to ascertain the diagnosis and then appropriate treatment. In this diagnosis, you also have now non-invasive procedures, ultrasound. And this ultrasound sometimes take a dynamic picture of moving organs and moving like blood. You can see the blood moving. It's a very efficient technique as well, non-invasive. There's also an elastogram and some thermometric procedures there that can help to diagnose. Dynamic medical thermometry, ultrasound imaging, thermograph, EIS 3D scan, which is now electrointerstitial scan, EIS, electrointerstitial scan, 3D, and these are other diagnostic ways to that can help to make and diagnose breast cancer fully. All right, we know that with the CME, continuing medical education, as well as medical thing, that is during our treatment when the implicit configuration now, the AMZ 5-cos-12 IPCA, where the MU stands for matrices now, that it will, in the implicit configuration and the pharmacochemical application, that we'll see an interface of the medical education, CME, with the amazing fiber active matrix. So when we come to that bridge, we'll cross it with the implicit application of our amazing fiber active matrix in the treatment. And we'll once again know that this AMG 5-cos-12 matrix was developed by yours truly, and the precision method of helping to make prescription as well as enhancing the choice of drug, pharmacochemical choice, was also developed by yours truly in a personal sort of faculty, intellectual faculty. But it's not been used much. It remains implicit because I'm not really practicing medicine as such, but I'm in medical research, and I've kept that in my own personal security portfolio. So this continuing CME, which I said is versatile, it means we have interface sometimes with mechanical engineering and electrical engineering and mathematical engineering. All these fields sometimes interact and interface really and come together as one. Because you use maths and engineering in the diagnostic thing really. So the interface, and when these interfaces occur, sometimes these abbreviations carry multiple representation.